Okay, let's talk about sulfonamides. We're going to break down everything you absolutely must know for your nursing exams and for keeping your patients safe. Let's dive right in.
All right, picture this. You're on the floor, or maybe you're sitting for your NCLEX, and you see a patient is prescribed a sulfa drug. What are the first things that pop into your head? What are your immediate priorities? Keep that question in mind as we go.
So here's our game plan. We're going to cover the basics, the big contraindications, the adverse effects you'll watch for, your top nursing priorities, and then a really simple memory tip to help you lock it all in.
First things first, the fundamentals. What are sulfonamides, and what do they actually do in the body? This is a huge exam point, so listen up. Sulfonamides are bacteriostatic. Now, that just means they don't kill bacteria directly. Instead, they stop the bacteria from multiplying. This gives the body's own immune system the chance to step in and clear the infection. You're going to see common examples like sulfamethoxazole and sulfasalazine. They have broad-spectrum coverage, meaning they work against both gram-positive and gram-negative bacteria. That's why you'll see them used a lot for things like UTIs. Next up, contraindications. These are your critical red flags, the situations where you should absolutely not give this drug. This is all about safety.
So who can't take these? This is non-negotiable. First, never give it to a patient with a known sulfa allergy. They're also a no-go in the third trimester of pregnancy, for infants under 2 months old, and for any patient with severe liver or kidney disease.
Now, let's say your patient can take the drug. What are the potential complications you need to be actively monitoring for? You've got 4 key adverse effects to keep on your radar. Photosensitivity, which can cause a really bad sunburn. Blood dyscrasias, which are serious disorders with blood cells. Stevens-Johnson syndrome, it's rare, but it's a life-threatening skin reaction. And crystalluria, which is literally crystals forming in the urine that can damage the kidneys.
And this is probably the single most critical warning sign. If your patient on a sulfa drug develops a new rash or starts complaining of a sore throat, you have to report it immediately. It could be the very first sign of Stevens-Johnson syndrome, and it needs urgent attention.
So what does this all mean for you? Let's put together your action plan for patient safety. What are your nursing priorities?
Okay, here's your checklist. First, encourage a high fluid intake. We're talking 2 to 3 liters a day to prevent that crystalluria. Advise them to use strict sun protection. You're also going to monitor their labs, especially their CBC for blood issues and their renal function. And of course, always assess for that sulfa allergy before giving the first dose. All right, I know that was a lot of info, so here's a super easy way to tie it all together for your exams. Just remember the sulfa memory trick. Let's run through it. S is for sunburn, from that photosensitivity. U is for urine crystals, or crystalluria. L is to look out for that rash and sore throat. F stands for fluids, fluids, fluids. And A is for allergy assessment before that first dose. Simple, right? So, after going through all these key points, which one of these potential side effects will you be watching for most closely? Answering that for yourself is a huge step in becoming a truly safe and vigilant nurse.